Patient appears well dressed, appropriate for the weather. Patient does not seem pale or cyanotic. Patient's skin feels warm, not diaphoretic. Patient's attitude and expression seems calm. And we will begin. I will walk you through everything and I will let you know what I will be doing. Okay?
Okay.
And also my name is Seeham. So I will begin by just examining your scalp. So the top of your head, I will be running my fingers through your hair. And just checking for any infestations, meaning lice or any parasites, any trauma, any scabs, any injuries, dryness, flakiness. Patient does not have any infestations. Patient hair is full. Okay. Scalp is dry, not overly dry, not overly moist, and pink. Okay. Thank you. Okay. I will be moving down to your eyes. We will be testing your cranial nerves 5 and 7. So what I will have you do is just raise your eyebrows for me. Good. And frown. Very good. And smile. Very good. And just close your eyes. And I'm going to have you try to open them. Perfect. Thank you. I'm going to test your eyesight. I will give you a card to look at. We're going to do one eye at a time. So I can hold the card out for you. And very good. So we're going to be testing the left eye. Are you able to read this line here for me?
LTFPH.
Very good. So our patient has 20/20 vision in the left eye. And do you mind switching and read that same line again?
LTFPH.
Very good. And a patient in our right eye his right eye is 20/20. Can you tell me what color this is?
Red.
Very good. And this one?
Green.
Perfect. Patient is able to differentiate red and green. So now what I will be doing is testing the cranial nerve number 3. I will be shining a bright light into your eyes. I just need you to look straight ahead over here. And you're going to see a bright light. And I will do that to both eyes. Ready?
Mm-hmm.
Okay. Good. One more time. Good. And I'm going to do it one more time, okay?
Mm-hmm.
Very good. So I also did test for the Hirschberg. Both eyes reflected equally. There was no deviation in either side. Patient's eyes, again, which was testing cranial nerve number 3, were equal, round, and reactive to light. Pupils are about 2 millimeters each and reacted briskly when the light was shined or shown on them. I'm just going to take a look at your conjunctiva. Just look up for me. I'm going to pull down on your eyes a little bit. Very good. So patient's conjunctiva is a pale pink. No inflammation. Lacrimal duct is not inflamed, nor are his eyes overly watery. Just open your eyes nice and wide for me. Patient's sclera is white on both sides. Okay. Also, again, not watery. Patient's lashes are intact. No edema, no edematous eyelids. Patient's eyes are symmetrical to his face. Okay. So now what I will do is I will dim the lights and I will be shining another bright light in your eyes to take a look at your optic disc and your retinal background as well as your retinal vessels.
Okay.
So I'm going to start on the right eye and just look again straight ahead. You're going to see a bright light. Okay. And we're going to do the same thing on the left eye. Same thing, look straight ahead. Okay, very good. And I'm just going to turn the light on again, okay?
Okay.
So patient's optic disc is yellowish pink bilaterally. His retinal backgrounds on both eyes were a dark pink, dark red, and retinal vessels were seen, also red, no signs of hemorrhaging. Okay. So now, I'm gonna switch this. We're gonna move on to your ears. So I'm just gonna palpate on your tragus here on both sides. Just let me know if there's any pain. Does that hurt?
No.
No. And how about here? Any pain?
No.
No abnormalities are felt or seen. Patient's ears are symmetrical. Patient's traguses are symmetrical as well as his pinna. And again, nothing was felt or seen. So I will be taking a look inside your ear, just taking a look at your eardrum, okay?
Okay.
I am going to pull on your ear a little bit. Okay. Very good. Patient's tympanic membrane is nice and pink. Is not concaved. And I'll do the same thing on the other side. I'm just going to pull on your ear. Same thing. Patient's tympanic membrane is nice and pink. Okay. So now what we're going to be doing is a hearing test. I'm going to start with the whisper test, where I will basically take a whisper word into each ear, and you basically just repeat it back to me. Okay?
Yeah.
All right. So I'm going to start on your right ear.
Cat.
Okay, and we're actually going to do 2 words, if that's okay.
Okay. House.
Okay. And same thing on your left side. We're gonna do numbers on this side.
2.
Good. And
10.
very good. So the patient has passed the whisper test. Now what I will do is it's called a Weber test. I'm going to take this tuning fork and I'm going to place it on the center of your forehead, and you let me know if you hear it more on one side versus the other. Okay? Ready?
Mm-hmm. Left.
Left. Okay. So patient does have laterally better hearing on the left side, or is able to hear it a little bit more on the left side. So now what I'm going to do is a Rhine test. So what I'm going to do is I'm going to have you listen to it in the air first, okay?
Okay.
Can you hear that?
Yes.
Okay. And can you still hear that?
Yes.
Good. Very good. And same thing. Can you hear that?
Yes.
Good. One more time. Can you hear that? Oh, it went away. Hold on. Okay.
Yes.
Okay. Very good. So patient has passed the Rhine test on both sides. Both air conduction and bone conduction were normal. Right. So now we're going to move on to your nose. I'm actually going to start by just palpating your sinuses. I'm just going to apply some pressure on your face and just let me know if you feel any pain, okay? So we're just going to do your sinuses here. Any pain?
No.
Good. And one more time, I'm going to check your sinuses up here, okay? Any pain?
No.
Okay. And then I'm just going to take a look in your nose. Do you mind just looking up for me? Okay. Very good. Patient's turbinates are nice and pink. No discharge seen. Septum is not deviated. Septum is symmetrical. Okay. I am going to test your sense of smell. That's testing your cranial nerve #1. So I'm just going to have you smell this and just describe it for me.
Sweet.
Very good. Thank you. Okay. Okay. So now I'm gonna check your mouth. So again, I'm just gonna have you open up your mouth for me. Good. Buccal membranes are pink and moist, intact. Teeth are intact. Stick your tongue out for me, please. Tonsils are not red. No discharge, no purulent discharge, no tonsil stones. You can relax. Tongue is nice and moist and pink. We are going to check your tongue muscles by check your cranial nerves. Number 12. Do you mind just sticking your tongue out for me? Stick it out and move it side to side. Very good. Thank you. So by doing that, we just checked your cranial nerve number 12. I am going to check your gag reflex as well. So that is your cranial nerve 9 and 10. Okay?
Okay.
So I'm just going to have you open up and stick your tongue out. And you ready?
All right.
Okay. Thank you. All right. All done. I am going to actually check your peripheral vision. So I'm going to just start by covering one of your eyes. Either one. Okay. And I'm going to hold my hand up and you let me know how many fingers am I holding up. Okay?
Okay. 3.
Okay.
4.
Okay. Good. Now switch for me. Very good. No. Okay.
3.
Okay.
5.
Very good. Okay. And then one more thing we are actually going to do with your eyes is I'm going to check your cranial nerves 3, 4, and 6 by having you follow this pen for me. So just keep your eyes on this and you're just going to follow it around, okay?
Mm-hmm.
Good. And then just one more test for your eyes. Just look straight ahead and cover one eye. Good. And now looking at that same spot, cover the other eye. Good. And there was no deviation or in his stare, and no eye went either way. No eye deviated laterally. Okay. So one more thing that we have to do with your mouth is I just have to have you grab one of these. We're going to check your cranial nerve number 7 and 5 by just having you taste something. Okay? And just describe what you taste.
Salty.
You can spit it out. Thank you. And now what we're going to do is I'm going to take a listen to your breathing and your lungs, okay? Actually, you know what? Yeah. Okay. So you don't have to take deep breaths or anything. Just breathe normally. Okay? Did you finish the eating?
Yes.
Okay. All right. So right here, we hear tracheal noises, which trachea is symmetrical. It is midline. And then a little bit lower, we're going to listen to bronchiovesicular noises. Good. And then in his chest, we will listen to vesicular noises. Very good. And posterior, we're also going to hear vesicular noises. Take a deep breath in for me. Very good. One more time. Again. And one more. Okay. So patient's expansion is symmetrical. Breathing is not labored. Respiration rate is about 16. Breathing evenly, non-labored. And do you mind just saying ah for me?
Ah.
Good. Fremitus is felt. Okay. Thank you. I will now listen to your heart. Again, I'm just going to have you don't have to breathe or anything like that. I'm just going to be listening to your heart rhythms or your heart sounds, okay?
Okay.
So, here. Okay. So in the second intercostal space on the right side, we are listening to the aortic valve. Okay. And then when we move over to the left intercostal space, we're listening to the pulmonary valve. Third intercostal space is Erb's point, also on the left side. Left side, fifth intercostal space. Tricuspid valve. And fifth intercostal space, midclavicular on the left side, is the mitral valve, or the point of maxillary impulse. Okay, very good, thank you. So both S1 and S2 sounds were heard, no murmurs, no galloping, heard in heart sounds. I'm gonna just take a feel for your pulses. I wanna just check your temporal pulses. Good. No jugular vein distension noted either side. I'm just gonna take a feel for your carotid pulses. Very good. No thrill felt. +2 on both sides. Thyroid does not feel enlarged. Any pain when I push here? I'm just going to also take a listen to the carotids as well. No bruit heard. Okay. And no sounds heard in the thyroid either. I will move down to your brachial pulse. Okay, 2 heard. Very good. Do you mind standing up for me, please? Thank you. So now we will take a listen to the renal arteries, which is above the umbilicus. Good. No thrills. Okay. The iliac arteries. No thrills. And the femoral arteries. Also no thrills. And then we already listened to your brachial, so I'm just going to take a feel for your radial. Very good. 2+, which is a moderate pulse. Good. And then we already listened to your femoral. I'm just going to listen to your popliteal, or feel for your popliteal pulses. Very good. 2 on the left. Your posterior tibial. 2+, and your pedal also on your left, 2+. And then we're going to listen to your right. I already listened to your femoral. Again, your popliteal. And your posterior tibial. Very good. Popliteal is 2+, posterior tibial is 2+. And last one is your pedal, which is also a 2+. Okay, you can have a seat. Thank you. All right, and that completes my exam.
Thank you.